your neck, back, hips, shoulders constantly feel tight, no matter what you do, your body may be using that tension to help create stability for breathing. And once you understand how breathing changes pressure inside of the body, the tightness finally starts to make sense. A lot of chronic tightness is actually the body looking for stability. One of the biggest ways the body creates stability is through pressure, which is heavily influenced by breathing. Your breathing system and your core function are deeply connected. Your core helps manage pressure and create support for the body. And because your nervous system highly prioritizes breathing to survive, it will create tension anywhere it has to in order to keep that system working. That's why you can stretch, strengthen, foam roll, whatever, and still feel tight again a day later, because the body's still managing pressure in the same way. Why do muscles get tight? Often because they're overworking as stabilizers. The body is a chain of muscles. Your neck, your chest, your back muscles all attach into your rib cage. Your glutes, your hip flexors, your hamstrings all attach to your pelvis. And your abdominals connect your rib cage to your pelvis. Together, all of those things help control breathing and pressure through your trunk. Because of these connections, the way that you breathe can directly change which muscles stay tight and end up overworking based on the position of the ribs and pelvis. What should normal breathing look like? When you inhale, the rib cage should expand in multiple dimensions, three-dimensional, front, sides, and back. The diaphragm, which is our main breathing muscle, should move down, and the abdominals should help control the rib cage so that the chest wall can expand. Once you exhale, the abdominals should help to compress the rib cage, deflate the chest. That becomes a nice stable position for the body to function from. But many people lose the ability to do this correctly. One common breathing pattern people get into is where the belly moves without any rib cage control. Instead of expanding the rib cage, the stomach pushes outward, the ribs flare up, the lower back often tightens underneath of that because the diaphragm actually attaches to the lumbar spine. So a lot of people, when they hear breathing, they get told to belly breathe, but they're already doing that. And good breathing mechanics aren't just pushing your stomach outward. Breathing should be able to create movement through the entire rib cage expansion, not just in the front of the body. Another common pattern is staying stuck in a partial inhalation all day. The ribs stay flared, the lower back stays extended, the diaphragm stays really flat. Instead of being able to pump vertically, the diaphragm becomes a stabilizer and the abdominals start pumping instead of the abdominals being able to stabilize so the diaphragm can pump. And if we stay expanded all day through our rib cage, we can't breathe in efficiently very well. So we start using our neck and our chest and our back muscles to help pull the air in. Your neck can actually lift up your rib cage during inhalation. So if your diaphragm and your rib cage aren't managing pressure efficiently, your neck starts helping with every breath. People breathe at least 20,000 times a day. So imagine doing all of that with your neck. That often creates or leads to headaches, migraines, neck pain. That can also lead to jaw tension, shoulder tension, back tension. All of those things can try to create opposition or stability for the rib cage for breathing. So the body isn't just getting randomly tight, it's trying to hold itself together and create some kind of stability to pull air in. Another dysfunction can occur when abdominal muscles don't coordinate correctly. We have 4 different abdominal muscles and they all have their own job. Sometimes we have certain abdominal muscles that end up overworking. That may present as abdominal gripping, abdominal bulging, or doming of the abdominal wall. We may start to get paradoxical breathing where the abdominal wall starts moving in the wrong direction when we're trying to breathe in. All those things can contribute again to neck tension, pelvic floor dysfunction, SI discomfort, tailbone pain. If these things are happening in an asymmetrical fashion, often that's why we end up twisted or stuck in a pelvic rotation or one shoulder lower because of the necessary expansion that needs to occur through one side of the rib cage. There's additional muscles that need to help create stability for the body as well to support the rib cage and the pelvis, not just through our core muscles, but scapular muscles, glute muscles, all help to position our pelvis correctly so that we can expand the rib cage, and move efficiently. Breathing should be able to create different movement options, not just lock you into one position. And one of the first steps in improving any of these patterns is often learning how to fully exhale. Many people stay partially inhaled throughout the day because they've lost the ability to fully exhale and are unaware of it because they're not controlling their pressure very well. And holding on to extra air is actually a stabilization strategy. It's just not a very efficient one long term. Over time, this can contribute to postural changes like forward head position, rounded shoulders, slumped position, flared rib cage, anterior pelvic tilt, or asymmetries, depending on what strategy your body's using. But ultimately, if it loses the ability to effectively manage pressure, something has to create stability to take over. And again, that's where you start to see a lot of these tension components that won't go away because they're helping hold you in a position where you can breathe. So body's not just randomly tightening, it's creating tension where it feels unsupported. This is sometimes why stretching or reset techniques might help temporarily, but then they don't last fully. If the body feels unstable at some point, it's going to recreate that tension because you have to breathe. So once the body feels supported where it needs to, you won't constantly feel that tension. The issue may not be that you need more stretching or even that you need more strengthening. It may be a pressure and stability problem. When breathing mechanics improve, the body often doesn't need the same tension strategies anymore. The body relaxes when it feels supported.